raised about the placement of medical graduates into public facilities. Trade Union Solidarity says scores of doctors, nurses, dentists and other health practitioners have not yet been placed to complete their community service. For more on this, we are joined from Durban by the Minister of Health, Dr. Motsoaledi. Dr. Motsoaledi, thanks very much for your time. Are you aware of these claims that are being made by Solidarity?
No. I'm not aware, Vuyo. I started hearing about them on Tuesday when I read one of the daily papers.
Has anyone, has any member or staff member from your office then tried to investigate as to what it is exactly that may lie behind these claims?
Well, we work with various unions and we have told them that in these placements, they must please inform us wherever there's a problem. I might have to remind you, Vuyo, that on the 12th of December, we issued a media statement that we are going to place 1,883 doctors for internship, newly qualified doctors for internship. We're also going to play 1,465 doctors for community service, as well as more than 3,000 nurses for community service nursing, and then other health professionals. I remember 766 pharmacists, etc., etc. Those numbers still stand, Vuyo, and we further emphasizing that statement, and we are still emphasizing these are statutory positions. Those people have got to be placed. We have got no choice but to place them because it's the law, which we ourselves have passed. Now, those people have been placed as we promised. However, at the present moment, as I'm speaking, 668 community health pharmacists might not have taken their position because they have lodged appeals and asked for made special requests because they don't like the health facilities where they were placed, and they believe they can appeal and be placed afresh in other facilities which they are comfortable with. There are various reasons which of course they use. So those 68, it's not that they are not placed. They are placed, but they are not going there because they believe they can still be placed elsewhere. In the internship among doctors, we have got 80 interns who might not have taken their place, also for the same reason. They've appealed, they said, I don't want to go to this place, these are my reasons, etc. Those are being considered. If they are talking about those, they must know that they are considered, and we've got 2 committees to deal with appeals and special requests. In all the committees, the South African Medical Association, SAMA, is represented because we want to be very transparent. So it's not only government officials who are dealing with those appeals. We also have members of the associations of doctors who sit in there and look at each and every one appeal and the request and whether we are dealing with them very well.
So you are saying, Minister, if I'm hearing you correctly, that where there may still be people who have not yet been placed, it would only be because they would have objected, for whatever reason, to being placed where at the hospitals where they or clinics where they would have been allocated places, and you are busy dealing with that. In other words, other than that, there is no other problem as far as you are aware.
No, we have placed them. Placing them is to name a hospital and a name of a person.
Yes.
And say, Vuyo Mvoko, you are going to Charlotte Maxeke. That's placement. And we have placed all 1,883 interns, 1,465 community service doctors, and I've mentioned the number of nurses, pharmacists, allied health professionals. They've been placed. Now, I am saying from the medical side, we know that 668 might not have gone where they've been placed because they've lodged appeals and say, please place me somewhere else. That's exactly what I'm saying.
Okay.
And on the interns is 80. And yesterday, we received a communication from Western Cape where they were saying 6 posts of community health have not been occupied yet, and they want people very urgently. They were even saying if we don't respond in quicker, they are going to have to place foreign nationals who are looking for jobs in those positions if South Africans don't come to claim those positions.
Now, one newspaper, Minister, The Citizen, says there's a doctor who got a post, then appealed his placement, and his appeal was apparently successful. But then when he showed up, he was told there were no resources to give them a post. Are you familiar with such cases?
I saw that on The Citizen. I immediately approached the newspaper. I said, please give me that doctor who has not been placed, because I want to place him. In fact, I told them I'm making the request for 2 reasons. That doctor further said he has received 3 emails from the department which said there are no resources to employ him. Now, that's very wrong, Vuyo. It's very wrong. If anybody in the department has issued such emails, it's actually illegal, because this is a community service doctor whose job he deserves statutorily is by law. It's not a favor. So anybody who can write him emails and say there are no resources to hire him is acting illegally, and I want to take action against those people. But if you remember, the newspaper said the doctor is anonymous because of fear of victimization. I then said, tell him I'm prepared to sign a sworn statement, an affidavit under oath that will never victimize him. How do we victimize somebody who's claiming something that is legally his? And I've been waiting from yesterday. It's only now, 30 minutes ago, while I was rushing to the studio, that I've realized the doctor has contacted me, and I've not yet read what he's saying. But I wanted to put him on the job. But I also want the 3 emails to see which one of the officials in the department issued such ghastly statement, because all the officials have asked under human resources, officials have asked under finance and all that. All of them claim that they don't know anything about those emails. So I don't know who has issued them, and I want to know. But as for that doctor, I want to give him a job, because it's his statutory right to have that job.
Now, and if there may be other people who find themselves in a similar boat to this particular doctor, where do they go if they feel that perhaps they have exhausted all avenues? And
they can contact me.
Your department?
They can contact me, Vuyo. Yes, they can contact me, because they know who to deal with in the department. But if they are not satisfied, I'm available, because I want to understand why they could not be satisfied. Because Vuyo, I'm repeating now for the 3rd time, and we started saying this in December. These people are talking about interns and community service. It's statutory. That means it's a law which was passed by us, that when somebody has completed these studies, they need to do internship, they need to do community service. The reason that we did so, Vuyo, is because if you don't do internship or community service, your life has come to a standstill. You can't do anything else. You can't continue with your further studies. You can't go to the private sector. You can't open a private practice of your own. You can't go overseas. You are just stuck. So we can't allow human beings to be stuck like that. It is something that has to be solved. The reason that we issued the statement in December was to inform the nation about that, so that they know. And when we deal with these matters, they know our position. And that position, as I said, still stands. We haven't changed it.
Minister, before I let you go, can you just clarify one issue for us? And this is with regard to listeriosis. Now, there are people who are still claiming that it has re-emerged in spite of you assuring us that the listeriosis outbreak is over.
Vuyo, I think I'm answering that question from you for the 2nd time. Listeria has been in South Africa for the past 40 years, if you remember. What we had in 2017 up to the end of last year was an outbreak. Certain number of infections happening at a very fast pace. Now, when we said it's over, we meant the outbreak, not listeria. Listeria is still there. It has been there for 40 years, as I said, it will still be there. It's like Ebola. You are aware that we had an outbreak of Ebola in West Africa in 2014, which put the world in a spin. From there, it was announced that that outbreak is over. It doesn't mean there's no more Ebola in West Africa. It is there. But what has ended is the outbreak. And in South Africa, it's the outbreak that has ended. Anybody who gets a patient with listeria shouldn't be surprised, because for the past 40 years, we've been getting 60 to 80 patients per annum who have got listeria. And that situation still stands. What we have brought to an end is the outbreak which hit us in 2017 and 2018.
But what is being done to ensure that it doesn't develop into an outbreak, or the cases that are there, at least?
Well, firstly, Vuyo, the listeria was not a notifiable condition, because for a disease to be notifiable, it must satisfy 5 criteria, and listeria was not satisfying them. But after the outbreak, it satisfied all the 5 criteria. It is now notifiable, meaning any doctor or health worker who come across a patient with listeria will have to notify, and then will be able to see almost on a daily basis whether the infections are growing. That's number one. Number two, the NICD, the National Institute of Communicable Health, together with experts in microbiology, have developed protocols on what doctors and hospitals and even doctors in private need to follow to make sure that this outbreak doesn't repeat again.
Minister, thanks very much for your time this evening. Dr. Aaron Motsoaledi.